you've been thinking of treating those unsightly veins on your legs, now is the perfect time to do it. And you should know why. Those veins can cause some major medical problems. Here to talk about the medical issues surrounding deep vein thrombosis, Dr. Maria Bein and Maria Bein from Vein Specialties. Welcome back, you two.
Thank you. Always a pleasure.
It's a mouthful. Deep vein thrombosis. What is it?
Well, quickly, if you remember from school, the arteries send blood down to your muscles and other organs. The veins bring back the used up blood back to your heart to be purified in your lungs.
Okay.
If the veins don't work, the blood will just sit in your veins. When blood just sits in your veins, you'll get symptoms, but you'll also increase your risk of clotting that blood.
And Maria, what are some of those symptoms we should look for if there is a problem?
For a deep vein blood clot, you can have a sudden onset, blue, red legs, very swollen, very painful, or it can be completely silent. Many people have died totally not knowing that they had a blood clot in their legs.
Who's at risk here?
Age. As we age, risks increase, but varicose veins and venous insufficiency, people who smoke, people who have a life-changing event such as cancer or an illness, a surgery, pregnancy, hormonal supplements, birth control pills.
And people who travel a lot, I
obesity,
understand.
traveling, you're immobilized, you're not circulating that blood, and that can happen at any age, young, obese, slim, athletic.
And we do have some before and after pictures to show you just what this looks like, so you'll know if it is in fact you, some before and afters. Yeah. Before they came to see you, that's what it looks like on the left there. Dr. Bein, what did you do?
Well, what we've done here is an office procedure which is covered by insurance. It's recognized as medically indicated. We do laser therapy, which involves putting a little laser fiber into the vein, sealing the vein, and the procedure takes about 40 minutes, 50 minutes. Walk out of the office, go back to full activity the next day if you wish.
It looks painful. It
looks painful if you walk around with that, but the procedure itself is essentially painless, and the recovery time is minimal, if any. The results are spectacular. I personally have performed over 3,000 of these procedures in my office. No hospitalization, no complications, no infection. This is quite a miraculous procedure.
Do you need a ride home? You don't even, I mean, is it that simple? I go, I leave, I have lunch?
Well, we ask that someone drive you home purely because if there were an accident, the police would blame you because you've had a procedure.
Oh, gotcha,
But you can drive if you wished.
And here's another example. The first one was much more pronounced. This one is still very evident.
Absolutely. What's happened here is we've sealed the vein, and we have, through very tiny needle sticks in a cosmetic fashion, removed what you can see on the surface. Importantly, especially this month coming up, the varicose veins are the only way that you can tell ahead of time that you might have an underlying vein problem, because if you have a varicose vein, you've got an underlying vein problem that may lead to one of these 80 million cases of deep vein thrombosis seen every year.
And so seeing that tells you you may have deeper issues, which is why you need to get it dealt with.
I couldn't have said it better.
Oh, well, then we're finished here. And did we mention, is it more women than men?
It is more women, not for deep vein thrombosis, but for varicosities, it's probably 70-30 women to men. But deep vein thrombosis can affect everybody equally, depending on your risk factors.
And you mentioned needles, and the minute you say needles, a lot of people just draw away from the TV because they hear needles and they think it's going to be painful.
No, actually it isn't. It's quite painless. The way we perform the procedures, it's essentially a painless procedure.
What happens at the screenings? Because you do very well. A lot of people, after they see you on Great Day, your phones ring off the hook because people want to get the screenings.
Well, it's very important that the people, if they themselves don't have the problem, they know people and relatives who do have the problem. We strongly urge you to give us a call. Your screening will take about 15 minutes. I see every patient individually.
Okay.
I evaluate with ultrasound. All of these are free. We're very concerned that the general population is not getting the attention they deserve for vein problems. So if you have varicose veins, if you have heavy, aching, tired legs, you need to call us for these vein screenings.
Okay, 10 minutes, just 10 minutes. If you'd like to get checked out, Vein Specialties is holding free screenings, I said free screenings, at their office in Creve Coeur Saturday, February 25th, and then Saturday, March 31st, another screening at their Washington office. That one is on March 10th. To make an appointment, call St. Louis Vein Specialties at 866-626-VEIN. Thank you so much, you two.
Always a pleasure.
Always good to see you. Ken?
All right, contact lenses, they can be expensive. Up next, how to make sure you're getting a good deal and good product when ordering online, plus your chance to win a $250 Clarkson Eye Care gift card. Then, if you don't know what you're having for lunch today, well, I think our Deal Divas might be able to help you make a decision. We'll tell you where you can get lunch for free. And if you have picky eaters at home, you'll want to see this recipe for garden risotto. It's a fun, flavorful way to sneak some veggies onto anyone's plate.
Have a great day, St. Louis.